hey, everybody. Welcome to the Med List. It's me, Kevin, and this is Donna. And we're so glad you're here. That reel is just playing right off the bat, even though Kevin did not click the button. And I'm talking to myself in third person here, which, maybe our guest can help me with not talking to myself in third person. That could be a real trait that I should explore further. But Donna, I think that it's really interesting. Your and I's conversations offline, are very personal. I deeply care about Donna's life. Donna deeply cares about my life. And we try to support each other in lots of different ways. And I think that having that across a nation is really fascinating, right? You have someone that's over in Massachusetts and someone that's in Washington. And I don't feel like a lot of people have that across the street, today. And so it makes me very thankful for our guests that we have coming on to be able to talk about something that it's a really raw place, this loneliness that we have as a society and the mental health struggles that are going on. But any things, Donna, that you kind of experienced career-wise, personal, you wanted to intro before we bring on our guests?
I just think it's important to be able to learn about all different types of care that you might need at various times in your life. And sometimes it might be some mental health care that you need. And hopefully we can peel away some of the stigma of that, Kevin, and make people feel like, hey, I really need to talk to somebody, and that's okay.
Yeah, I totally agree. Well, bring on some people from a location near and dear to my heart, all the way from the Yakima Valley. I'm going to add them to the stage now.
So hello.
Hello.
So today we have with us Taylor and Emily Vickerman, and they're therapists located in Washington State. They have a heart to provide accessible mental health education via social media. Their mission is to help reduce stigma and that their content causes people to feel seen and understood in the midst of confusion, frustration, and suffering. And thank you guys, because I don't typically give intros this way. It's all about what you've done and accomplished and everything else. I love this. This is what your plan is. This is what you're doing. This is what you want to keep doing. So thank you for that.
Oh yeah, thank you.
Of course, yes.
Thanks for having us.
Yes, thank you. We're happy to be here.
Thank you.
So glad you guys are here. And by the way, Taylor on one side and Emily on the other side, in case you guys were wondering which one is Taylor and which one is Emily. And usually have guests join on like two different screens, but this is really unique that we have a husband-wife combo joining us in both this venture for them going into mental health and taking care of patients on this piece and life for each other. And so we're thankful you guys are together represented here. Tell us a little bit more about that togetherness. Tell us about your guys' relationship and how did that lead to the current career path you guys are on?
Yeah.
It's a great question.
Yes.
Do you want to answer?
Yeah, I can start.
Go for it.
So Taylor and I we started in vocational ministry. That was where we met and ended up getting married. Later on down the road, we both had our own mental health struggles. I struggled with OCD and anxiety, and Taylor has struggled with depression. And with those struggles and also seeing struggles within our youth, because we were youth pastors, we saw students having panic attacks, high anxiety, depression, suicidal ideation, felt very unequipped to be able to address it. And so we were youth pastors together, and we went on this journey of becoming counselors together. So we went to grad school at the exact same time, the same program, and graduated at the same time as well. So it's really been a journey together. And yeah, we were like, why stop now? Let's open our own private practice together.
Wow. That's amazing. What a great story. I can only imagine having your significant other and best friend to be by your side in going through that journey with you together. And I can't imagine the conversations you've had throughout the years. That's amazing.
Yeah, we've had some deep car talks.
Probably a little too much.
Yeah.
We have to figure out about fun things to talk about sometimes too. Not that what we talk about isn't fun. We love talking about it.
Yeah.
But gotta talk about, I don't know,
Lighthearted things.
Yeah.
There you go. That makes so much sense. So I'll start things off, I guess, from just a summarization perspective. Taylor and Emily, give us this right now. When it comes to what are we dealing with when it comes to mental health in the U.S.? What in general are people suffering from or issues they're encountering? What are some of the gaps that you guys are seeing in folks getting help with those aspects of their life and that mental health care that they so need? Give us a little bit of a summary of looking at the nation in general, why you guys decided to go into this field and where you think the needs really sit.
Yeah. Well, Kevin, I think that's a really beautifully complex question. And I'm sure if you were to ask 10 people, they might get 10 different answers, but not that those 10 different answers conflict. There may be different aspects of the kaleidoscope. And I think one of the aspects of the kaleidoscope that really intrigues me kind of is on tune with what you kind of were talking about at the beginning about the loneliness, that there really is a loneliness epidemic. And the stat, I can't remember if it's Barna or Pew Research, but one of those big research conglomerates did a study and found that a really high percentage of Americans had 0 to 1 close relationships.
Wow.
And that's been reflected as true in our professional practice. And yeah, it is an epidemic. Not that is the root cause of the epidemic, because there's many probably if you really looked at it, but that's a huge piece of it. And so, when you look at things such as support systems or what we call protective factors in our kind of counseling lingo for things that really help you be a resilient person, these close relationships that you have really do help for a lot of different reasons. So I'm sure there might be 100 different questions that come from that. I don't want to go on a whole train, but if there is anything that comes from that, that's kind of maybe one thing that you would look at and could dissect for a while.
Yeah. Do you see that? I know that during the pandemic, loneliness really became a very pivotal point and became a conversation for many. It was all over the news too. Do you see that is maybe changing a little bit, that people are recognizing loneliness more so than before, in that people reaching out more, people trying to not be lonely or try to find tools in order to reduce loneliness? Have you, and I'm assuming you've counseled people with this issue too. So, could you tell us a little bit about that? And then maybe what's a tool or something that people could actually try?
Mm-hmm. Yeah, absolutely. We definitely see that people are more aware of their loneliness. They're coming in and saying, yeah, I feel lonely. I need more friends, more friendships. But there's those barriers to kind of break down. There's the busyness in our culture. People are working really long hours and then taking care of a family, or doing another job, just multiple things going on, to where they don't even have the time or capacity where they feel like they can invest in relationships and find avenues to them. Along with that, we have people coming in who express their loneliness, but then they can't find resources to be able to meet other people. That's a huge one that we run into, especially if people are not in any type of religion, whether it's Christianity or Judaism, Mormonism, whichever one it is, especially if they're not practicing in any of those and have a community around that, then it gets really hard, because it's difficult to find community just in locally. So that's a huge struggle, is just finding those places where people can actually connect. Even looking at going to the gym now, putting in the AirPods and just doing your own thing. And this is just consistent across all areas where there's a disconnect, and there's some barriers that are in place that are making it difficult for us to address this loneliness epidemic.
Mm-hmm. Wow.
We often talk, Donna, about in older age, there's like a level of resilience, right, that the body has, right? There's a capacity that you have to be able to withstand some kind of healthcare attack that may occur, a heart attack, a fall, whatever it may be, that you're able to recover, right? If you have less comorbidities on your plate, you're able to recover from that event and continue to have a decent quality of life. When it comes to the mental health side of things, what you guys mentioned there with relationships, is that one of the factors that you feel is there in your reserve tank to be able to bounce back from a traumatic event, if it's something in the mental health realm? What other pieces do you think are necessary for people to build up their toolkit? I feel like Taylor might have used that word with me sometime, but to build up their toolkit, basically to say, here's my reserve is, like, here's the ability for me to be able to recover from a mental health issue that may have come up.
Yeah, absolutely. We know that it's difficult to suffer. It's even more difficult to suffer alone. So when we have people around us who we have deep, meaningful connections with, we are able to recover much quicker. Like you mentioned, you see that physically, we also see that mentally. If we have people who are a safe space for us, who accept us as we are, who don't judge us, and who show us, hey, you're worth being with, even if you are at your lowest right now, that in itself is so healing for people. More than people could ever imagine. That is so healing. And if people have that, if they have family members or friends or a church community who loves them unconditionally and non-judgmentally, they are in such a better space to be able to recover.
Yeah, for sure. I would love to learn a little bit more about your business itself, and the name of it is Soul Care Center. And I'm just interested in, this counseling side, but then also those who are accepting of a spiritual counseling side of things too. And I'm assuming that people that you have come to you are probably from both sides of that equation, if you will. So, like, how does that come about, and what in your practice? I know you've been saying a little bit when people have that community, if they have that spiritual community. I know that my friends at church, they're awesome, and we spend a lot of time together. But what if I didn't have that? What if, and I know I needed counseling? Like, how does one help the other, if you will? Or how do you decide whether someone could benefit from spiritual counseling as well as traditional counseling? I'm going to say, I don't even know if it's the correct way to say it.
Oh, no. That's beautiful. Just to speak to that, who we see everyone. And from kind of our approach to counseling, I kind of will double down on kind of the communal aspect of what we're talking about.
Mm-hmm.
And belonging is a really interesting yet beautiful thing, right? Belonging is actually paradoxical in a sense, though, because to belong, you have to be known, and you have to be known fully, and you have to be accepted fully. And you have to be accepted fully in the midst of your flaws. And that's a really difficult thing to do. We're married, right? She accepts me and all my difficulty, on my worst days and my best days, but that does something for me in my innermost being that causes me to live with a little bit less weight on my shoulders, because I know out there, if I'm out there in the big bad world, like there's at least one person that I can come to and just say, I'm hurt. I'm really struggling. I don't know what to make sense of this. I'm actually scared what you're going to think of me, and to be met with a smile and with just a hug, and to say, hey, I accept you and I love you for who you are, where you're at, in spite of what you do for me. That is a huge healing piece. And so that's a spiritual principle. You don't have to be a person of faith or anything to do that. And the word spirituality really kind of looks at this idea of something of paradox, something of a higher order of living towards something that's above or beyond the self, right? So in my marriage, right, like it doesn't really make sense sometimes for me to live sacrificially in my marriage, or to do something that costs me, but the cost of it it means something to me. It actually helps me grow in love towards my wife, but also does something in my wife. And so you don't have to be married to experience that. You can experience that in community. So that's my long way of saying we have spiritual things in our lives that we do all the time. I mean, on Sundays, you look at football teams and you see how much joy is at a football game. That is a spiritual thing. Hundreds of thousands of people literally experience joy.
Yeah.
Their team do something that is a game, but it's more than a game, right? So essentially, on the, if you wouldn't consider yourself religious or spiritual, we really love seeing that these little moments, these little pockets of joy and meaning help us create a resiliency to endure suffering. And so there are pieces of that help us bolster an ability to live through this crazy life with a little bit more joy, a little more optimism. But it also helps us recognize that these little pieces, they're not just whimsical or, pointless, but they actually contribute to what it really means to be a human. And so we try to pinpoint those. And then there are also other pieces of that, people who are really identify strongly with a faith tradition, that those frameworks really help people to make sense of the world. Because again, it's really confusing. Life is really confusing if you've lived longer than 10 years, right? It's like, oh my gosh, what do I do? What do I make? How do I make sense of the cards that have been dealt, or the tragedy that I am walking through right now? And what are some things that I can pick from to help me live through that, make sense of that, and live with a little more joy? So that was incredibly abstract, but all that to be said,
That's great.
we're spiritual people inherently, and we try to help people come into tune of that and help people live into that.
Yeah. I love that you made it that it's not necessarily religious. It's that being, if you will, and that support. That whether you're at a football game or whether you're with one other person, that can be that let's lift you up. And I'll take you for who you are. I think that's amazing. So thank you. That's wonderful. Love that. And I love that there's not necessarily, that 100% religious side to this idea of counseling, if you will, that we're really getting to the soul of it, right? I think that's amazing. Kevin, I think
that deep relationship component there is really special. And I think kind of peeling a layer back on what have we experienced previously in healthcare on how do we find those answers when we're not looking at relationships? We're not looking at that investment that Taylor described there as being a very vulnerable state to be known, right? To be able to be seen in ways that you don't want to be seen. So what does society currently do that Donna and I get to experience on our side of the equation is we look to go into a prescriber's office and find a pill that will end up helping us to no longer feel the way that we do, right? We look at something that I'm really curious. Here's some Kevin theoretical components here, but when we talk about loneliness right today, and I know Taylor is hopefully getting a PhD here sometime really soon, and we talked about this a little bit when we were looking through some documentation, but looking at social media and when we're talking about loneliness in general, and we think of the way that our brains and bodies work, right? How do endorphins get released? In other words, what are happy hormones that come through our body? And we look at likes and clicks and views of being something that says you are worthy and or meaningful, right? And so now today, like the sense of loneliness that I think is really interesting is going back to Taylor's point, is being seen but not known, right? We're missing that essential part of that equation. But I'd love to get your guys' thoughts on what you're seeing from the failures of our current system, or potentially how people are being set up to fail within our current system, and how you're rehabilitating that for individuals that are struggling with PTSD, anxiety, OCD, all the things that you guys are dealing with your clientele.
Yeah. And when you say system, Kevin, do you mean like in our society or in our healthcare system?
A little bit of both, Emily. Looking at, the healthcare system really delving into, here is the pill for helping you, and not having the time to be able to dive deep, right, into understanding you and provide essential elements. And the societal piece really looking at, here's how society is forming relationships, friends, networking, those kinds of things on social media, rather than what we were traditionally seeing in society of having someone across a dinner table that you know deeply.
Yeah, that's great. That's great. Well, yeah, I would say for the health insurance perspective from that area, it's difficult because there are providers who will just, get on medication, take this, and nothing else, no referrals to any therapist. And it's just supposed to be, this magic pill. If you take this in, you're going to feel better. That's generally not the case. So a medication does help. And I think, my supervisor, he worded this very well. He said, medication can help you if you're drowning to get your head above water, but it's not going to get you to shore. You need some extra help there. And so I think that really when providers like psychiatrists, or when primary care physicians, when they give the psychomedication to their clients, there should always be that referral to a therapist so that they can then have that in conjunction with the medication, because we know that's when it actually works the best. Because skills are taught that are needed, like for OCD, it's exposure response prevention. They're teaching you how not to do the compulsion so that your brain doesn't get stuck thinking it needs to do that. For anxiety, you're also going through exposures, but also working through thought processes and reframing. And with PTSD, doing eye movement direction. What's the last word? Response?
Oh, EMDR?
Yes. Yeah, EMDR.
Sorry.
It's a very long name,
Yeah.
but yes. So doing EMDR, any of these therapies, they're going to help people a ton. But if we're just giving them the medication and not addressing these other areas, they're really missing out on full healing. Going into then society as a whole and how we're missing things. So we have the digital age. We have Facebook, we have TikTok, we have Instagram. There's so many apps, and they're all coming out with new ones constantly all the time. I can't even keep up with it anymore. But people are so attached to their phones. They're looking at their phones thinking that this is community and this is connection, and they're missing out on the face-to-face and the shoulder-to-shoulder connections that are super important and needed. Our bodies are meant to be able to have our mirror neurons going off when we're looking at our facial expressions and from our body language, and co-regulating our emotions with one another. And there's just things that we can't necessarily do on social media if we're just scrolling and liking things and commenting on them, that we're missing out on that our bodies actually desperately need to be able to function well, that they're not getting.
Yeah. And doubling down on something Emily said, I think that forms your soul in a way that causes humans to be something to consume rather than be related to. When we are looking for that content to fill or spur dopamine in us, it becomes very consumeristic. And I think you experience that in relationships, perhaps. I mean, not with everyone, I hope, but with some people, maybe, right? You feel like they're not present. You feel like they're thinking about something else, and you can kind of tell. And that's not a knock on them. I think that's just the society that we're in general. And kind of compounding that with something that has been deeply formative in my experience as a practitioner, but also somebody as just a person, is there's a philosopher, his name is Dallas Willard, and he says, the greatest enemy of the spiritual life is hurry. Like, there's nothing else, just hurry. Like that's it, because it causes you to consume. It causes you to have this lifestyle of scarcity, to get something out of everything. And I think that just boils over into social media, our relationships, which just causes us to feel kind of like you ate 10 bags of Doritos at night and you're just like, why did I do that? And I just have Cheeto dust all over my fingers, and my stomach hurts and I feel like gross. I think that's how we feel a lot of our lives. And the invitation is just to stop, put down the bag of Doritos, Could there be something different for you? And so that always just comes to mind. And so.
All right, Taylor, I got to go right now. No, I'm kidding. The next thing's happening. Got to go. No, and it's true. I'm so guilty of that. Like, I'm guilty of that, the next thing, or prepping for the next thing all the time, instead of just enjoying what is right here and present. And I have to reset myself often to be like, whoa, no, do this right now. And don't worry about that next thing.
Well, Donna, I'm curious to ask you a question. What do you do to reset yourself? I'm really curious to hear that.
Oh, I don't know if I'm very good at it. So there's a couple of things. There's one that I will just try to be like, just remind myself to be in the moment. If, there's other stuff going on, I'm thinking about, what's coming up next or what I have to be at next. So I do try to say, just calm myself, be in the moment, and remind myself that it's important that I'm present here where I am with the people I'm with. So I try to think of things that way. When my mind rushes, and just thinking of all the to-do things, I've learned recently the importance of being able to just get the parasympathetic in place, if you will, and try to, instead of thinking about all of these things, just take a minute and just, even if it takes a full minute for me just to breathe and then just do a relaxation for just a minute. And I can find that that can be very helpful. I can feel my shoulders relaxing and okay, it's everything's fine. And, you can take one thing at a time. So those are a couple of my tools, if you will. But it took a long time to do that. Like it's taken a lot of years.
Yeah.
Yeah.
Oh, thank you for sharing that. That's beautiful. I think just to add on that, I love that sense, the sense of now, the sense of safety, getting that. And I think that's what a lot of us, and myself included, and thank you for sharing your vulnerability, because it's hard to stay present. It's so hard, but we need to remind ourselves that we're safe and that we're okay.
Yeah.
And I think that's what fuels our hurry, is that we're actually, if we stopped, we wouldn't be safe.
Yeah.
We would be okay. And maybe that's reinforced by the lack of support that we have. If we're isolated, we're going to hurry to make sure that we're going to be taken care of if we do stop. That's why a lot of people have a frustrating time going on vacation, because they got on the vacation, but now they can't enjoy it because if they stop, something bad's going to happen.
Yeah. Yeah.
Wow. Yeah, I love that. I think the present aspect that you guys are talking about there is quite interesting, because when it comes to therapy, like there's a Times Magazine article that came out that said that we are over medicated and over therapized, right? And so I was curious to go, okay, well, from my perspective over the years, it's really seemed like the medicated component has been a real problem. We've had individuals, as Emily's mentor said, and some of my mentors have said, we put on the rose-colored glasses, but we never find the destination where we can take them back off again, right? And so that's been a real plague in society, let alone some of the medication side effects that make it difficult for you to actually take them off ever, right, in general. And so I think there's some real problems to be addressed on medication only as a therapy toward mental wellness. The other piece, though, I'd really like your guys' opinion, especially that you guys are doing telehealth. So one thing that's been talked about here is that, I won't name any names, but there's a bunch of applications that are out there, right, that allow for mental health counseling. And a lot of experts are saying they don't feel like it's been effective. And I do wonder, from your guys' perspective, is that level of presentness a problem within modern therapy being digested in a very consumerist way, right? You have a problem, you go and talk to this person for 5 minutes, 10 minutes, and then you get off the phone, then you go back to your life and enjoy it again, and maybe talk to another person next time. Where's that relationship aspect? How is that important and different with what Emily and Taylor are trying to do versus what we've seen kind of prescribed in society's new way of thinking about therapy?
Speak to that?
Yeah, you go ahead.
I've been really deeply formed by Fyodor Dostoevsky in this, and that he wrote a book called Notes from the Underground, and he warns the Western society that technology won't actually lead to a utopia. And I'm afraid that perhaps therapy has been used as a technology to solve problems, but the irony is that humans aren't problems to be solved, or people to be loved. And though therapy, and I'm a therapist, I love it, and it's done tremendous good in my life. The point of therapy ought not to be to cure all suffering. It rather is give you skills and give you an attunement and awareness of yourself and what you deeply value, to then thrust you out into society with those skills, with that rehabilitation, to be able to cultivate those things that you learn in that relationship and apply those elsewhere. Does that make sense?
Yes. Can I make a comment here?
Yeah.
With what you just said, all I'm thinking of is, and I did have a question about medications, and then more medications being added on. And then, we have to potentiate this one. If you're not getting enough help with this particular med, let's add this other med on to help. And I'm thinking, right when you said that we're supposed to have tools, right? It doesn't mean that every single mental health situation is going to go away. It's how are we going to deal with it, right? And I think we've learned that through the opioid
Mhm.
crisis that we've had, that we're not going to wipe out all the pain. It has to become tolerable so that you can do. Not every single ache and pain is going to go away. And we have to rethink that as a society when we're thinking about how much medicine we're giving for pain. Is it tolerable? Can we work? Can we move? Can we be? And just what you said, I'm thinking, wow, this is really profound. Like, are we able to work through? Are we able to get out of bed, go for a run, or, walk or something, or go to work even? What tools do we have that we can manage and hopefully get beyond that a little bit and have a pleasurable and fulfilling life.
Yes.
But I also think it's really important that we see, like, this is all going to take time, just like, going to physical therapy for pain or something. It's going to take time and practice and, certain exercises. Just mental health is going to be that same way. And I think so many people think, I'm going to be on this for the rest of my life. I'm going to need to add more on because I'm really in a down spiral right now and I need all this medicine. But how do I ever get out of this? How do I ever change this? And I'm almost thinking that if we can do that parallel with pain, maybe it'll help bring people to understanding that, can we work through this?
Yeah. And Donna, I really like what you said there. How the ethos of what you said is, how can I make this pain manageable to be able to get to do something that I love doing? And that's a spiritual principle right there. Like, that is living in the midst of suffering toward a life that's meaningful, towards one that you want to live. I mean, that's the beauty of our humanity, is that we can push past suffering and in a hope that we can experience joy at the end of it. And so I think your question is beautiful because it's a belonging question and it's a joy question, right? Like, what is this thing preventing me from? It's not just preventing. Yeah, sure, it's might be preventing me from making money, but a lot of people, they just want to have a good life, right? They just want to have joyful experiences. And I think that's the beauty of what we are convinced of at Soul Care Center, is that pointing these pieces out, and what is going to help will you towards a life that's worth living. And yeah, you might have to take medication, and that's just a tool to help get back to where you want to be, right? I don't know if you have anything to add to this.
Yeah, I think it's a really great question that you asked, Kevin. I think a lot of times people come into counseling and they have the expectation that the therapist is going to fix them, and that's just not the reality. There's a lot of factors at play. For one, our job is not to fix people. It's to journey with them and get them skills that they need to help their quality of life and their functioning. And also approaching them not from, hey, I see you as a diagnosis, as, oh, you're a person with OCD, or you're a person with borderline personality disorder, but seeing them holistically as a whole person, which is kind of what Taylor's been talking about with the spiritual aspect coming in. Of, I don't just see a diagnosis sitting in front of me and I have this formula for that. I see you as a person, and let's address you as a whole person. And I think sometimes that can be missed in some certain therapy places because of the restrictions put on people by insurance companies to only use what they call evidence-based treatments and certain treatments for certain diagnoses, and not actually taking into consideration the person as a whole being. So that also contributes to therapy not being the most effective. And then also the client's willingness to change. Some people come into therapy and they don't want to put any of the work outside of therapy, and they don't have a willingness to change those, maladaptive coping skills and thinking patterns that they have. And if the client isn't willing to put in the work, the therapy is not going to make a difference or change them.
Yeah, I think the best way I describe that, and we will fully sit with you in the midst of wanting to get to that point. Like, that's what we love, that we're here for you, because often people don't have anybody that believes in them that they can change. Like, we come believing that you can, with the conviction that we can, even if people call us foolish, because I don't know, I just feel like we have to believe that. But I think the principle that Emily is a really great principle that I've been taught is, if you were to just rest your face it takes energy to smile. It takes muscle strength to smile. And in the same way, it takes muscle strength to live a joyful life. Like you got to try.
Yeah.
You really do. You know, you got to flex those those cheek muscles to experience it. Right.
Yeah.
And so it takes energy. And some people are just exhausted because they've been trying so hard. Right.
Mm-hmm.
And maybe that exhaustion, and maybe we can tend to that exhaustion and give you some hope. And that's where maybe our foolishness that we believe that you can change can actually be a conduit of change for you.
Mm-hmm.
It's really interesting that one thing you guys both mentioned, Emily, you're really touching on it there with the diagnosis piece. So for folks that are listening, like when it comes to the psychiatry world, the APA or the American Psychiatry Association puts out a book or a guide called the DSM, or what the Diagnostic and Statistical Manual, right? That basically gives people labels of this is what the diagnosis is for this individual. They have this condition. I'd love to hear from your guys' perspectives. And I'm going to bias this question because I guess this is our show, so we can do whatever we want. Right?
Do it.
But I guess with the question, it's really this: what does a DSM label do that is negative for both the therapist and for the individual? Because today I've never seen more individuals with diagnosis, right? As you mentioned, Taylor, you are a problem. Like, here is your problem instead of being a person, right?
Yes.
Give me a little bit of insight there when it comes to what you guys are seeing as an issue with labeling individuals for both therapists and for patients.
I have one thought before we jump in.
Yeah.
Emily is really good with response to this, but I think a phenomenon that you just kind of talked about, Kevin, is everyone having a diagnosis. I'll just speak to my personal experience. I just don't want people to reject me. Like, hey, I've experienced depression. Like, please don't reject me. Like, I'm a human. I got problems. Like, it's actually a cry for like mercy. And I wonder if our society is maybe coming up toward a more non-judgmental approach of people, which is probably a beautiful thing. Obviously, there's some downsides that I think Emily will talk about, but I think it's a phenomenological thing where people are just, hey, please don't judge me. I got some problems and I need some help. I do. I need some help. You know, I have a therapist that I see, and we train together. You know, and so I don't have it all figured out, but I'm just hoping that you wouldn't reject me if I vulnerability. So I think that's a piece of it.
Yeah. I think that with diagnosing, I have very mixed feelings on it as far as the negative aspects that can come from diagnosing clients for a therapist. Is that, for one, it can make us put them in a box. Like, okay, this is your diagnosis, and this is, like I mentioned before, the evidence-based treatment that I need to do for that specific diagnosis. And you can get stuck on that and not see the client as a whole person in all areas of their life that need to be addressed, not just this one specific diagnosis that they're having. For the client, what can happen is feeling pathologized, feeling like they have a stigma, feeling like there's something wrong with them, and kind of carrying that as an identity in itself, rather than seeing there's so much more than just this one little aspect of who they are. I think for positive aspects of it is that it can help give a framework at times for, hey, how should I approach this client? Because sometimes you will have a client who comes in and you need to know, how can I best help them? And knowing, okay, if they have, I'll say OCD, doing exposures with them and having them start resisting compulsions, that's actually is going to help them. But I'm not going to only address that part of them. Let's look at everything. Let's look at everything that's going on in your life. Let's look at your core beliefs, because that's going to impact your ability to resist compulsions, and look at your support system and all these areas that we need to take into consideration. But with that being said, it can give us kind of a framework at times for certain diagnoses, but I would say use those with caution and use them with that in mind, that it's always what's best for the client ultimately. Yeah. I
think a principle that I operate in as a counselor is once that I feel certain about something, I think I might have been too confident in the technology. And what I mean by that is once I think that certainty causes me to then have someone figured out. It can be a dangerous thing once you have some. I mean, even in our relationships, right? Like, as soon as I have Emily all figured out, well, that makes me just not discover her anymore, and then she feels misunderstood, and then our marriage goes down the drain because I'm not actively trying to discover. I'm approaching her with judgment and certainty rather than curiosity and openness. And so I think once we hit certainty, I need to get a little skeptical of, oh man, am I missing something here? And so I think that's a huge piece that perhaps we need to be more mindful of. So
Yeah. So I kind of want to get back to a little bit of multiple diagnoses, if you will, because not everyone has just depression. Not everyone has just anxiety. Sometimes they have depression and anxiety. So in, multitudes of varying multiple diagnoses. But then we get into multiple meds on top of that. So I'm going to do a little bit of an analogy thinking about someone with hypertension, right? And we don't necessarily treat with one drug, we treat with multiple drugs. And so now we have like mental health issues, right? And we might not be treating with just one drug, we might be treating with multiple drugs. However, someone with hypertension that changes lifestyle, that might use medicines for some time, but then lose some weight and exercise and do all these wonderful things, maybe meditation and et cetera, that we know can lower blood pressure. Eventually, we might be able to say they no longer have hypertension and get them off of their medicines and know that, they got things under control and were able to keep this in control. How likely is it that people with these multiple diagnoses for mental health, and as we're saying, what that does in the question before, but now we have multiple meds, and how likely are we to say that, oh, that person suffered depression or suffered anxiety, and they're able to, work through this, whatever, not have the medicines anymore. Now they have tools that aren't medicines any longer. How likely is that? And to me, why is it so difficult when I'm trying to share like things that are happening at a hospital? Somebody might be in the hospital because of a particular reason. I'm seeing low sodiums and QTC prolongation, things that are happening, especially to older adults with medicines that are for mental health. And I'm going, whoa, time out. There's other things happening here. We've got to cut back on these, or they're dosed too high for their age now, and things like that. I think I see people on these medicines for 20, 30 plus years. And I'm going, whoa, is this still necessary? So how do you feel about that? How do you feel about somebody who might have had something episodic happen, worked through, and yet they're still on the same meds, and maybe they don't? How can we reverse that? And how can we be successful with that?
Yeah, it's a great question. I definitely think that it needs to be assessed where the person is at. So let's say they come in, we do an assessment, generalized anxiety disorder, GAD-7 is what we would call it. We do that assessment, we see, okay, their anxiety is the highest it can be. But then they get on medication, they're in therapy, and over 3 months' time, we do the assessment again, and we see, okay, there's been a big reduction. Okay, let's now talk about lowering your medication a little bit. And then, getting to a place where, okay, maybe 6 months down the line, okay, let's try getting off of it now, and let's see how you're doing and assessing where the person is at. That's something that needs to be done more, that I think doesn't happen often. Us as counselors, we are not allowed to prescribe any type of medication because we're not doctors. So we generally have to go through actually primary care physicians. Psychiatrists are very hard to get into. And most of my clients, I don't think I've had one client who actually has been able to get in with a psychiatrist and work with them. So we're usually depending on primary care physicians. And often that follow-up and that checking in and assessing that medication and weaning them off and getting them to that place, it isn't done. And so then the person is left on their own, and they just continue to take the medication even when they're not necessarily needing it anymore. So it's a tough position to be in. And I think clients need to know and get back some of that authority of, okay, I need to be on top of my doctor about this and be talking to them about it and bringing it up. And therapists, we need to be talking about that with our clients. Like, hey, we've done this assessment. Can you bring this to your primary care physician and show them that your anxiety has actually reduced? And let's talk about your dosage now. And getting a release of information so that we can talk directly with their physician and make sure that we feel confident about where they're at with their medication.
Yeah.
And that's just one medication. And you're talking about, what do we do with several, right? So just multiply that situation times two. that's why we feel so confused.
Yeah.
And why people feel so confused.
Exactly.
And maybe to give a different perspective of it as well. I think our approach from our practice is simultaneously that, right? Like coming from like, hey, there's a real reality that you need some medication to perhaps help, just boost some stuff that's not functioning right now. And that's a real reality. But then there's another side to us where my supervisor once said, doesn't matter what people are diagnosed with, is what is this diagnosis taking them from? Right. And so for me, I feel like that's a really great, beautiful operating principle, because whether you're taking 8 medications, 40 medications, 0 medications, wherever, our beautiful privilege is to be able to help you identify, okay, this might be naming some things for you and maybe helping, but what do you want? How is this taking you from living a life that you want to live? And how can we bolster or utilize what these might give you to help you live a life that you, at the end of the day, really enjoy? And so I think that's my spiritual kind of side coming in as well to that whole program, if that makes sense.
Yeah.
I know that I could personally talk about this aspect of medication management, over prescribing, the role of pharmacists that need to start working with mental health counselors, probably for another few hours if we wanted to. And I know we don't have time, so I'll pivot slightly, not away from the medication piece, because I love your guys' thoughts here on how that can play a role, but self-referrals, having individuals recognizing and or someone in their care team recognizing these individuals would make sense to be clients of Taylor's and Emily's. How does that process work for an individual to self-evaluate to a certain degree and then be able to seek out help like you guys? And then the second part of that question is obviously going to be from the clinician's standpoint. You've got these primary care providers that are extremely overworked. You've got pharmacists that are in the community that see these problems and see people that are not benefiting from the drugs that they're currently on, or they haven't been put on anything yet, but they know that there is something they could do to be able to benefit themselves. How do we get both sides, and how do they evaluate? Do I need Taylor and Emily? Everybody needs Taylor and Emily in their life. They're fantastic.
Oh, thank you.
But to truly get to the meat of things, like how can someone assess themselves, and how can a provider be able to say, here's the best choice for me, and be able to find an Emily and Taylor?
Good question.
I think the first thing that comes to mind is maybe we could all just stop and get in a room together. Have just a good conversation about it.
Interprofessional.
Yeah, I think what we're doing right now is a step towards it. So kudos to you both for doing that,
Agreed.
for being faithful and doing that. And yeah, just maybe putting down the hurry and just having a conversation about, hey, we putting the bag of Doritos down, hey, what are we doing here? Is this working? And maybe it is, or maybe we're just seeing it differently, but I think having the conversation and then getting a room together would be something, a starting point. I don't know.
Yeah, I would agree. I mean, I think for people personally assessing, do I need to get into therapy? Just knowing, okay, what is my level of functioning? Am I really struggling to get out of bed or to take care of my kids or get ready in the morning? Am I struggling to be present at work and do my work? If your level of functioning is reduced to what it used to be and at a place where you're feeling like it's not the level it needs to be healthy, then I would definitely say you're at a place where you need to begin to look into therapy. And we see that with multiple different issues people are going through, with depression, with anxiety, with PTSD, with so many different things, where it can get to the point where the person's like, I'm at a point where I'm not functioning well anymore. In addition to that, knowing as well for people that counseling, we also help with skills in relationships. And most of us, if we don't do work on relationship skills, we don't have them. It's something that really needs to be taught.
Especially in a digital age.
Yes, especially today. Yes, especially today. People don't know how to do healthy conflict. People don't know how to communicate effectively without projecting shame. People don't know how to receive constructive criticism without feeling like they're horrible. And there's just a lot of things that can be taught relationally as well that can be really helpful for people. And so if people are seeing a consistent pattern of issues interpersonally with other people, I think that therapy is a great place to go to as well. Yeah. And as for providers, I think definitely when you're seeing clients coming in, say you're a primary care physician and you're seeing consistently clients coming in, and you're seeing the need for psychomedication maybe, or you're seeing them coming in with high anxiety, with depression, having a resource list available for them of, hey, these are some therapists that I've connected with in the community. Here's a list for you to go ahead and reach out to them with. But doing that work of networking and finding people that you feel like you can trust, that you would be willing to refer your clients to.
Yeah,
that's great. How do people afford going? I think insurances have done better throughout the years in reducing the co-payments for counseling. At least I've seen it in this area. I don't know if that's true across the board, but I think so. And I'm just going to do another analogy too. I think physical therapy is super expensive to go to, like for co-payments. It's like a specialist co-payment when you go, and I feel that mental health counseling has been much, much more reduced, almost like a generic co-payment, if you will. So if I don't know if you've seen that throughout the years, and I know part of what you guys are trying to do with Soul Care is to make certain it's affordable for people. So what does that model look like, and how can people access it? Or what should folks be looking for when they are trying to decide, one, am I going to go for a counselor? And two, can I even afford this? Are there certain things that they can kind of be thinking about and checking off?
Yeah, it's a great question. Yeah, we feel really passionate about preventative mental health care. And so that's our educational piece. And so, yeah, we have that on social media and in the form of classes as well that we have for free on our website. And I think there's a really great movement toward that preventative space on social media. And I think that kind of goes in hand, kind of, Kevin, with something you talked about with the self-evaluation. And it might be something that people, it might wear down some therapists. I don't know. It personally doesn't wear me down when people say it's self-diagnosed, but when they come in, I think people are just trying to make sense of what's going on. And I think that's been due in part because of the plethora of information out there. But I think for us, what we really emphasize is that, yes, that holistic component, the biological, the psychological, and the sociological, and then the spiritual piece, like that holistic model. And so in our education, we really try to reflect that, because all those pieces really give you a structure to have a life that's navigatable. And so that piece kind of, we feel like that helps people create some balance in their life that, could, I would hope that it could, solve a problem that they're having. I don't know why I can't feel like I can't relate to people, oh, it's trauma. Oh, wow. That's okay. And then they go on this whole, buy 4 books and learn about trauma, and they never have to go see a therapist. Like that happens, and that's great. That's not bad. But for people that still have more questions, that's where, we come in, and therapists around the world come in to help step in that space. So yeah. Anything else you'd say to that?
Yeah. I would just add, this is a problem, the affordability. It's an issue. For us as therapists, we have the reality of, we have student loans to pay back, and we have a family to provide for, and have to charge so that we can survive. But then also having such a heart for people and wanting people to get the help that they need. And it oftentimes we get put in tough places with insurance companies, and really what they will cover and how much they will cover. For example, couples therapy does not get covered by insurance, which, because there's not a mental health diagnosis, so it's not seen as a medical necessity. which I'm completely against because that overflows into all of your life and can cause so many different problems and will affect your mental health if your marriage is in a bad place. Not only that, but affect if there's any children involved. So there's that. Then on top of that, there's just the amount of time sometimes that insurance will allow a person to be in counseling. They might say, okay, you've been in long enough. We no longer want to cover this for you because you've been going for so long, which is also a difficulty. So then we go into where Taylor and I, we're in cash pay. So we charge directly to clients the fees. We don't go through insurances. Part of that is also because we're associate licensed and insurances don't want to cover us. So we have a hard time even being able to do that. But also it gives us a little more flexibility in working with clients where now I'm not tied down to having to give a diagnosis, which insurance companies make you do in the first 1 or 2 sessions. I'm now not tied down to having to use a specific treatment that they are wanting me to use for this. And so I have a little more flexibility. With that comes some clients can't afford to pay out of pocket, which is completely understandable. And so it puts all of us in a tough spot. And so to work with that, I provide a scholarship. One of my clients is on scholarship, so she gets a reduced fee to come in and see me. Some people do a sliding scale, so they assess, how much money do you bring in? What can we put it down to? And some places also do donations where they get donations in from other people, and they're able to give a reduced fee for people to be able to come in. Unfortunately, that's the best we have right now for this problem.
And I think that is what has been out there too. Like all of those things that you've said, I've heard that in the past. So I don't see that much has necessarily changed in regards, other than maybe the co-payment for those insurances. But like you're saying, it's very prescriptive as to what you are allowed to do or talk on. Could I just back up for a couple minutes back? I'm really interested. I know we're running out of time, but the preventative mental health, I don't think I have personally heard that being used together. We prevent all these other, keep your blood pressure low and, prevent diabetes and all these other things. But tell me more about preventative mental health and is it all over? Like, can somebody on the East Coast access that, or is this something that is new that you are working towards?
Yeah, it's a great question. Just like the food pyramid, right?
Yeah.
Everyone's seen the food pyramid. Whether that's legitimate or not, it's for debate. But we've all know it.
Mediterranean one.
I really like chips. I know that, and pasta. If that's the biggest one, then cool.
I like olive oil.
Doritos are big. This episode should be sponsored by Doritos. I feel that way.
Yeah, I think so too.
There you go, Kevin. That's our next sponsor, Doritos.
But that model, right? We have a model for what nutritional health is good for us, right? We have a paradigm for that, and there's also a paradigm for what it means to live with joy, in a sense, right? And we are compelled to believe that that is kind of the biopsychosocial spiritual model, which is kind of these quadrants, so to speak, of that have overlap, and like in the middle is ourselves, like is our whole self. And the more resources we have, or more awareness we have in all those little bubbles, really helps you be able to really push through a lot of difficult stuff in life. Studies have shown that people who are a part of religious communities actually have a really robust resiliency in enduring suffering. Obviously, in our Western post-Enlightenment culture, sometimes religion is seen as taboo, but really, when we look at the studies, when we look at the facts, that people actually have, whether it's their sense of making sense of the world, or philosophy, or worldview, whatever, they have people. They have people to support them, and that's a social factor. And so you don't have to be, Muslim or Christian or Buddhist or Mormon to have that. You can find that, but do you have an interwoven interdependency in that, where my belonging, where my being is dependent on your being, those are the things that really help us navigate difficulty and suffering. Just like having a framework of we need dopamine in our lives, right? Like it's a reality to feel happy. And so if we're not having dopamine, we need to find a way to get some dopamine, right? Or if we don't have, let's say, I'm trying to think of another example. The list goes on and on. So if we have that model of paradigm, so I think the preventative piece really comes with identifying those building blocks of having a psychologically joyful experience of life. And are we aware of what makes us feel like that in those different areas and pinpointing those things? So preventative in that sense, I think is all encapsulating, but to really give some language and some identification on what helps us.
That's awesome. Love it.
I do. I absolutely love it. I love that you went back to the preventative piece. I'm glad you guys both touched on that element. I mean, I know we're up against time, but that's really the big push that I think for me with Taylor and Emily is that it's great for that self-evaluation to be able to see what is the sick care model for you to be able to go and find folks that can be able to help you to kind of wrangle in what's going on and pave a path forward, not to find a solution or a check mark, but to find a path. But the other piece I think is the most interesting to me, especially having family and friends in the Yakima Valley throughout Washington State that should be using Taylor and Emily, is that preventative piece, really trying to say as a society, like how well are we doing as husband and wife? How well are we doing as parents? How well are we doing as these other things? And we don't prioritize those, right? I mean, Donna and I talk often about if you're taking X number of drugs, 3+ medications, you should be sitting down with your pharmacist at least twice a year, right? If that's cash pay, anyway, you should, because drugs are complex, right? Drugs hurt people. Life is complex. Mental health is complex. I don't think it's any different that individuals should be sitting down with a qualified mental health individual, counselor, therapist, etc., at least once or twice a year, even if they don't have something going on, to do a check for preventative services. So I think that is a good call out by Taylor and Emily that needs to be a priority inside of healthcare. Any last components, Taylor and Emily, for the rest of the audience to be able to do? One, find you guys and learn more, and then two, any other parting words?
Yeah. Well, to find us, you can go to our website. I think that you guys might have it here, but yeah, Soul Care Center of the West Coast is our name. So just looking that up. And if you're interested in doing therapy, you have to be in Washington State, because we are only licensed in Washington State. But if you're in Washington State, you can go in there and fill out in a contact form. And then we set up a 15-minute free consultation call. So we get on the phone, we talk to people, ask some questions, just make sure we're both a good fit for each other going into it. Do you want to add anything to that?
Yeah. We really like being with people. We find it a deep privilege to be able to sit in confusion and mystery with people, because that's just the nature of counseling. Is it's confusing and it's mysterious, but somewhere in the mystery you begin to find some sense about where you're going, and it's a joy to be able to sit with people in that. So we never judge, we always accept, we're always open, and we really believe that space helps us feel like we can begin to start living again. Whatever way that happens is, I don't know, but it happens. And so we have fun doing it.
Yeah.
That's great.
I love that. Yeah. I think that the verse that always comes to me when I think of this space is really for people to come to folks that are heavy burdened and that they will give them rest is something that is so interesting. When we think of biblical spiritual connection of how do people help people as well, right? Yeah. How do we be able to share that burden? I'm really thankful, Taylor and Emily, that you spent time with Donna and I today to talk about how you're helping other people with their burdens and how you guys are enjoying it along the way as a couple. I'm just very impressed. Everybody, thank you so much for tuning in. We'll hopefully see you guys next time, and you can check Donna and I out on LinkedIn, Facebook, Spotify, Apple, YouTube. And we will see you guys all next time. Have a wonderful rest of the day. And if you need Taylor and Emily, we'll send some show notes and links out later. Have a good one.
Thanks, everyone.